Welcome, and this is Documenting a Pandemic, Past and Present. I'm very excited that you're here to join us. I'll introduce you to our panel in just a minute. And you can see on our little title page, we've got 3 different examples of documenting pandemics. And so just to do a brief introduction, I'm going to introduce myself and introduce the other people who are our hosts today. So I am Shane Carter. I'm the program coordinator for an office called Orias at UC Berkeley. I do outreach to K-12 teachers and community college instructors focused on international topics and global topics. So my colleague who's working with me on this, who's also at UC Berkeley, is Rachel Reinhardt.
Hi, I'm Rachel Reinhardt. I direct the Berkeley History Social Science Project, and we're one of the member organizations of the UCB Professional Development Providers, which is putting on this calendar of near daily webinars for teachers. And our work is with K-12 teachers, primarily in the Bay Area, around history instruction, defined broadly. And it's good to see so many familiar faces.
Yeah, it's really great to have so many people on. If you just joined, you notice there is a poll that's in progress that you should see access to. If you could answer the few questions there, that would be great. They are anonymous. It's just a chance for us to see who's actually in the room. So the first person that we're going to have speaking to you is the person who actually created the assignment that was the inspiration behind us doing this program, and then we'll introduce you to our speaker. After Monica Green, our speaker, does our presentation, we're going to have a breakout session, as you can see, and then some question and answer, and then we'll finally end with how to submit student work that you get your students to do associated with this assignment. So I'm going to stop sharing my screen, and Bryan, it's to you.
All right, hi, my name is Bryan Shaw, and I saw a lot of you guys who logged in. I know quite a few of you from working with UC Berkeley. And so I'm just a quick introduction. I've been teaching for about 17 years. I've been part of the UC Berkeley History Social Science Project for about 13. I started as a participant, teacher leader. It's kind of been one of those life-changing moments as an educator for me, working with people like Rachel and Phyllis Goldsmith and Devin Hess and so many other great leaders through the project, where it's kind of created this reflective teach for me. And so right now I'm struggling through, like a lot of parents, teaching my own kids. My wife's a history teacher at high school level as well. We have a first grader, we have 2 kindergartners, and we have a college kid we picked up a couple of days ago that is finishing her semester here as well. How this project came about, early on when we started thinking about, my wife and I are sitting around watching The Office, because that's what we watch, kind of thinking through, well, if this really happens where we're not going to be able to see our students on a daily basis, how can I get what I want from my students and help them finish the school year? And I'm not going to read to you because you guys are professionals, but that was kind of my overarching question is, we've spent a lot of time thinking through historical thinking skills, and so that's where I wanted this project to lie. I focused on being skills-based, just because I knew at the end of the year, if it was going to be content-based, it'd be giving kids packets and online stuff. I didn't really want to do that. I teach thematically, and so throughout the school year, we look at themes as opposed to chronological order. And so it actually has worked out really nice, where the kids now are getting to the point where they're reading current events, and they're able to tie it into other things we've studied. I needed a low-tech option because 85% of our kids are on free reduced lunch. We think about 30% have internet at home. We've been handing out Chromebooks the last couple of weeks. So how could I have my students do something meaningful at home that's low-tech? I want kids to be able to deliver their assignments in multiple platforms. If they were artists, they can draw. If they were musicians, they can write a song. If they're poets, they can write a poem. You can just kind of do some chronology of the day-to-day experiences they're having in their house, and also a way for them to vent, talk about their fears, talk about the things they're facing at home. And lastly, thinking about we've studied all these primary sources throughout the year, from the civil rights movement, from the gay rights movement, from all these different perspectives. Now the students get to be that perspective, and they're leaving this narrative where they're the center of it. And so I want to create something that was empowering for them to be left behind, that they can be proud of. And here's just kind of a sample of when I got early on. And this is, you know, thinking about my students, this is what a lot of our kids are facing right now, you know, and thinking about how can they really look at this as a historical moment, you know, and how they can archive that and just have their writings be true to who they are and leave that written record of what they're experiencing. Thank you.
Thanks, Brian. Sorry, it took me a minute to figure out what I was doing there. Okay, so I think what we're gonna do next is we will switch over to Monica, who Rachel and I reached out to. So Monica, you're welcome to share your screen whenever you are ready. Rachel and I reached out to Monica Green to see if she would be willing to come on and kind of share the stage with Brian and talk from the standpoint of a historian about what historians use to make sense of epidemics in the past. So whenever you're ready, there we go.
All right, hello, everyone. My name's Monica Green, and I just wanted to preface what I'm saying today is, why am I, as a medievalist, involving myself in trying to help navigate this cultural moment that we're in dealing what is a disease that is only, as far as we can tell, about 4 or 5 months old. I mean, and even being able to say something like that is absolutely extraordinary. It's not all going to become clear, but I'm just going to go through it quickly, and I'm happy to answer any questions in the Q&A later. So my training was actually in the history of science, and that is playing a very big part in the work that I do now, because so much of the work that I'm doing now is reading really, really, really recent science and figuring out how to draw historical perspectives out of it. I am a fellow of the Medieval Academy of America. I've been lauded by my colleagues for a variety of different achievements, but this work is really, really, really new. My main field as a historian is the history of medicine. And again, I do specialize on the medieval period. I spent most of my career working on aspects of intellectual and social history, and mostly working on women and gender issues. And that there is a book that I published called The Trotula. No plague, and not a whole lot of infectious disease that's mentioned there. Next slide, please. Okay, so this is what I do now. I call this field a global history of health. It will become clear why I call it global, as you will see. For the Middle Ages, for medieval Europe, there are 2 infectious diseases that we have always known are the most important in terms of their social ramifications. And those are plague and leprosy. Now, leprosy is an infectious disease, but it's not an acute infectious disease. It takes a long time for it to transmit, for it to incubate in the body. Very quickly, it doesn't cause epidemics, and it certainly doesn't cause pandemics. So plague really is the critical one. And for most of my career, we couldn't say anything as historians about the history of plague. And the reason was because both of these diseases are caused by microorganisms. In fact, both of them are bacteria. So these are single-celled organisms. So this is the problem for us as historians, is we look at documents, we look at written documents. We look at people who have observed their world and written words about them. Nobody in the Middle Ages will have seen microorganisms. So nobody will talk in their texts about microorganisms. So there was various sorts of things that we could do in terms of saying, well, gosh, a lot of people have died. A lot of people have died very suddenly. The symptoms that they have at death have just been described in a certain kind of way. So we sort of kind of knew that plague was plague, but we couldn't prove it. And there was a debate that went on for about 30 years about whether or not it was. Enter the microbiologists, because the microbiologists actually know how to document the presence of microbes. And anyway, what has developed over the course of the last 20 years is a new field of biology called paleogenetics. And what they're doing is they're not finding, little test tubes full of bacteria. They're finding teeny tiny little fragments of the genetic material, the molecular material of these organisms. They piece those together and say, aha, this is this organism, this is that organism, and so forth. It's incredibly technical work. It's incredibly high powered. It demands massive amounts of computer power and millions of dollars. But when they get results, they get very, very big and important results. And so this is what has happened with the history of plague. And the diagram that you see over there on the right side is the phylogenetic tree. And actually that one is pretty old. That one was published in 2013, 7 years ago. Everything about that has changed by now. But that gives you a sense. And if you look at that circle right in the middle of the diagram, that's the Black Death. They've actually retrieved Yersinia pestis, that's the bacterium, from a cemetery in London that was a burial site for the Black Death. So anyway, everything that we know, or everything that we can say with certainty about the history of plague has been determined really in the last 9 years. Next slide, please. Okay, so what does this have to do with what we're dealing now? The coronavirus is a virus. It's not a bacterium. It's a very different disease. Everything about it is different. The disease interval, how it transmits, so on and so forth. But what I also do, besides doing the history of plague, as I said, I also do the history of leprosy. I also do, or I assemble the information about malaria and tuberculosis and smallpox and syphilis and cholera and HIV/AIDS. So those are diseases that span the entire breadth of human existence up until the 20th century. And the ways in which we can document them all share certain commonalities. We can ask similar kinds of questions about the history of these major human diseases. And so that's why when Ebola came along in 2014, I was able to make kind of a historian's intervention with that. And now with the coronavirus, they're the similar kinds of methods, similar kinds of science that's going into creating a global understanding of this. Now, at the same time I was doing this, I was also learning how to teach a regular global history class. And for that, a former colleague of mine, Laura MacArthur Harris, was just a phenomenal help to me. And one of the things she did to me was really teach me the basics of how to do global history. And those are the basics, really, that the essence of it is right here, is that we have to think at scale. There's certain questions we can ask at a local level, certain questions that we have to widen out and look at community. We widen out again and look at region, widen out and look at state, national, international, global. At a certain point, we can look at the whole globe. And that's exactly what we have to do now, is look at the whole globe. We are all, as humanity, suffering from this disease together. I mean, it is simply astounding. And this is why I'm calling this chronicling a pandemic at the speed of light. The virus moves at the speed of human bodies. It moves at the speed of cars, it moves at the speed of rail travel, it moves, most importantly, and which is what has made it so quickly global, it moves at the speed of aviation. Our communications, though, move at the speed of light. And that's what I think is the biggest positive thing that we have going for us now. We are a global community, and we can think as a global community, and we can pull together all the kinds of analyses that your students will be doing, and your communities, and your representatives, and most of all the healthcare workers and the healthcare and the public health services throughout the entire world. So that's what I want us to think about, is think about these global dimensions. Next slide, please. Okay, so I am not an archivist. I work in the Middle Ages. All the stuff that I work on was created 600 years ago, 800 years ago, 1,000 years ago. So I don't have to think about that. But as I said before, I had worked on the Ebola outbreak back in 2014 and started to put together an Ebola archive. I'm not trying to do a coronavirus archive now, except for my own purposes of thinking about, okay, what are the kinds of things that I want to have as a teacher. But once I was asked to do this presentation, I found it very, very interesting to think about the ways you all who are in the classroom with students can start them to think about archival thinking. And one of the things I'd like them to do is don't do a Daniel Defoe. Don't pretend to do a journal of the plague year, because there's some very basic facts we need to remember about Defoe and his work, which so many people treat as if it's history. It's a novel. It's a novel that was written by somebody who probably didn't have much aside from very limited childhood memory. So he would have been 5 years old in 1665 when the last big plague hit London. So that was the Great Plague of 1665. He writes this his Journal of the Plague Year 40 some years later. I'm sorry, 60 years later. And it is not in the context of a plague outbreak in London. In fact, there are no more plague outbreaks in London at this point. What's happening, and what's the current spur to his commentary, is that there's a plague outbreak in Provence in the south of France. And there is international terror that's going on because of this new crisis. And so there's a lot of rhetoric, there's a lot of posturing, there's a lot of, implied fantasy really about what he's doing. What I think your students have the opportunity to do is to be authentic precisely because they are living through it. They are in the moment. And that's what I would want to see them stress, is not to pretend that they are the big chronicler, but chronicle their lives. Chronicle their lives in the way that they would tell their siblings, their younger siblings, their own children, to think about how has your life been affected? What routines have been disruptive? What fears do you have? Are those immediate fears, like, are you going to have dinner tonight? Is your family going to be able to pay their rent? And then what are the long-term fears that you may have? So I would want to encourage stressing that to students, to think about their own lives and their perspective, their unique perspective on the world. Next slide, please. Okay, so pandemic thinking. So I wrote or I edited this book that came out in 2014, Pandemic Disease in the Medieval World. This is available for free download. Anybody who wants to have it, it's free. You don't even have to register to get it. And I can, if that's not already posted on the website, I can share that with Shane. So one of the things I keep insisting, because this is very, very new and challenging work of trying to get historians who work with written texts to engage with other fields that are documenting the biological world. And that's part of what we're all becoming biologists right now. We're all becoming epidemiologists because we have to. because that's the world that we have to live in. Those are the constraints that are coming on us. So there's just several things that, Shane, if you could just kind of click through. And so thinking about whose job it is of these different kinds of specialists to think about the ways in which plague interacts. And I'm not going to go through the biology of plague. Basically, it's a rodent disease. It's spread by fleas and only incidentally comes into humans. So what the geneticists are doing is they're looking at the microbe. They're looking at the bacterium. What I'm insisting we historians need to do is keep looking at the humans. And then both the geneticists and we historians need to communicate with the archaeologists, because the archaeologists are the ones who are working with the material record of human bones, human bodies, grave sites, and to a certain extent, still a limited extent, the rodents that might have been spreading this disease. For the entomologists, retrieving physical evidence for fleas, I'm not holding out hope that that's going to be possible. So that's where we get population biologists or modelers who will be doing that kind of work. Okay, next slide. Okay, so coronavirus is a virus, not a bacterium. Geneticists are also tremendously involved in chronicling the spread of this. And for any of you who have looked at Next Strain, and there's a couple of other sites who are taking the genetic sequences of the virus that's been sampled in various places and creating these trees, these family trees, these phylogenetic trees that are documenting how it's spreading, where it's spreading, kind of where it's coming from, and going into different communities. So in a certain sense, the coronavirus is much simpler to track. And as you probably already know, it's the tracking is almost instantaneous. I mean, so basically they get a genome sequence and within days, they have it sequenced and then they have it added to these big cumulative phylogenetic trees. And that data is also going into the work that Hopkins is putting into is that map and the cumulative total of cases and mortality. And one of the things that I would like to suggest, and if I was in the classroom right now, I would be suggesting it to my own students, is this is a tremendous opportunity for students to dive into geography. I mean, and in all the senses of geography, of learning about different land masses and so forth, but also learning about different cultures. So I think it would be a fabulous opportunity is whatever your student is doing in terms of documenting their own lives, they try to do at the same time a parallel study of looking at, find an individual, find a country, whatever it is they find and they can latch on to. A pop star, for example, a K-pop pop star that they want to follow. Just some way to look at another part of the world and then just say, okay, what does the world look like if we make a stand over here? You know, where's the curve? Has the curve been flattened? Is it still rising? What are the debates going on about PPE or toilet paper or whatever it might be, that students have the opportunity to really see another part of the world. And again, the amount of news that's being circulated is phenomenal. Okay, next slide, please. Okay, there's just a closer look. And again, this is open access, 24/7. You can find this, and you know, to the extent that you can stomach it, engage with the information, and all of those data in there. And if you haven't played around with this, they call it a dashboard at Hopkins. You can refine, you can zero in on any piece of data that you want, any country, any statistic, anything. Basically, you just have to kind of click on it and you can zoom in. Okay, next slide, please. Oops, we missed one. Okay, so as I said, this is global. This is an argument I've been making in my own work, but the coronavirus situation has brought it home forcefully, is this is affecting us for one reason only, because we're human. That's it. This wonderful quote that Mary Fisher made. Mary Fisher was gave a speech at the Republican National Convention in 1992, and that was 1992. And it was in a variety of ways a major turning point in our understanding and public reckoning with the AIDS crisis. And she made this speech, and the point of her doing it was she was a middle-class housewife from Utah and just defied every category that people had been thinking of about HIV. She wasn't gay. She wasn't, living in a big urban environment. She was heterosexual. She was married, and yet she was infected. And what she said is the simple truth. It is always the truth of infectious diseases. HIV asks only one thing of those it attacks: are you human? And this is what I have personally found amazing about the whole wash your hands messages, which apparently everybody has finally grasped. And that's why I'm just reminded by, this is some of the earliest art that we have from, and we find it all over the world, of humans. These would be in the Pleistocene, the Paleolithic, humans drawing pictures of their hands. Because that is our signature as humans, and that is also what we need to focus on in the ways that we are communicating with each other and creating a global environment. Next slide, please. Okay, so all of us are overwhelmed by information. All of us are on phenomenally steep learning curves. And I've been doing this stuff for a long time, and I'm on a very steep learning curve. So one of the things I would encourage everyone to do is just, again, getting that global thinking of thinking on different scales, is when you get stuck asking any kind of question, the perfect move to do is pivot to a different scale. Say, okay, we need to go bigger, we need to go wider, or we need to go more fine-grained. But start asking these kinds of questions. And so this was just a list of firsts that I came up with. And so one of the things, so I've been capturing pictures of things that I'm finding on Twitter, things I'm finding on the internet. And over on the left side there, I have two things paired, which I posted together in a mini Twitter feed. There's this amazing video. I assume it's still circulating, but it's in Spanish. But the thing is, and it was just somebody taking, he's got plastic gloves on, and what he does is takes, I guess, what is shoe polish, and show why it is that you need to kind of be systematic about washing your hands. Because most of the way most of us wash our hands is not systematic. And anyway, it's just this amazing video. It's in Spanish. And I haven't taken Spanish since like 6th grade, but I can look at it and I understand it. Really, anybody could understand. This was circulating all over the world. So this is the big thing, is just focus on these ways in which you are human and that you're starting to see your world work. I'm not going to go through all of these individual questions, but this is the kind of thing of what has been your own learning curve? When did you first start doing X, or first start asking why? Next slide, please. Okay, so some historical models. So again, what I want to emphasize, just to repeat, is I want to say this is global. We're all in this together. I'm literally the whole world. We are reckoning with our common humanity. And the other thing I want to make sure we reckon with honestly and insistently is that this is trauma. Whether or not somebody individually has had their grandparents threatened with the disease, whether individually, this has come into their own household, this is trauma for everyone. And we need to keep saying that, we need to be recognizing it, and we need to cope with it. I am not trained as a therapist. I would have to defer to others that have that kind of training, but we have to say this is there. There is no, you'll be all right. because none of us will be all right. All of us have already been affected. All of us will continue to be affected. So let's acknowledge the trauma. Let us also acknowledge that what will have to happen for all of us is that we're going to have to let go of some of our past and create a new future. And that's why I think this assignment that Bryan has created is so, so powerful, because it is empowering individual students to take that charge. So the last thing I want to do is just share with you this one document. It's a document from Bologna, from northern Italy, at the time of the Black Death. And it's in a wonderful little collection, which is available online already for free, put together by she was in fact one of my colleagues. She died a few years ago, and left behind her, unfortunately, her own young children when she died. Anyway, she put together this collection of materials. Her name's Shona Kelly Ray. And next slide, please. And I've just quoted. Oh, there it is. Okay. Quoted it, and some of it probably will be cut off on your screen because of the presenter portraits. But let me just read a few parts of it. In the name of Christ, amen. July 23rd, 1348. So this is the first full summer that plague has been spreading throughout Italy. It had probably arrived really right at the end of 1347. Ursulina, daughter of the late Thomas Ursi and widow of the late Philocarius, he had just died like the week before. Known as Carrillo, parchment maker in the parish of San Biagio, healthy in mind and intellect, but sick in body. So she already knows she is sick, and because the will was probated, and we in fact know she died soon after. Declares her will thus: she leaves 5 lire for the benefit of her soul to be distributed by her heirs as they deem most useful for her soul, of which 5 lire, 5 solidi are to go to Don Gerardus, her parish priest, and the rest are to be distributed as she said above. She leaves 20 lire for her daughter Isabetta, daughter of the late Philocarius, known as Carino, demanding that she be quiet and content with this sum. And what kind of comment is that on her, what will become her deathbed, is to be making this comment to her daughter. For all of her goods and property, movable and immovable, and all of her rights and actions, both now and in the future, she institutes as universal heirs, so they inherit everything, her 3 sons, Thomas, Johannes, and Bernardus, sons of the late Philocarius. She declares that this is her last will and cancels and invalidates any previous testament or codicil. And then the rest of it is just, the verbiage about documenting it and the witnesses. And the thing about reading these primary sources, this is something that she created for an immediate purpose. She created it so that, number one, so prayers would be said for the benefit of her soul, and so that she could pass her material goods onto her own children. She didn't leave us for us. And that's one of the things that we always have to wrestle with as historians is, whose voice are we hearing? And who are they talking to? Most times, and we do have chronicles. So chronicles really are written for the benefit of posterity. Probably just kind of local posterity, not necessarily the whole world, but written for that. She's writing to say, I'm dying, my husband just died, and I want to give these goods to my children. I want to control what happens in my afterlife. So anyway, it's just a way of conveying to your students that sense of, this is how we live our lives. We live our lives on the personal. But then we work with the structures of government, in this case, the structures of law, in order to create a reality for ourselves. Okay, next slide, please. Okay, so the last thing I want to encourage you to encourage your students to think about is spread. I mean, they will, I assume, also be looking at, political information, local public health information, looking at national political debates, and so forth. But a very big thing that has also come into discussion, quite rightly, and I'm actually very pleased with this, is people are saying, what about the environment? We already had a climate crisis we were trying to talk about. And one of the things that people have already been saying is, look at what's happened to the Earth in the last 3 months. The Earth has started breathing again. The skies above India, the skies above China have been clear. The waters in Venice are so clear you can actually see the fish again. And I wanted to share this slide, this image from a study that came out in 2017 of looking at lead pollution in ice cores. So these are digging down into glaciers and creating samples of ice cores. And in this case, they put together information about the amount of lead that was circulating in the atmosphere. And one of the things that puts lead in the atmosphere is silver mining. Look what happened right after the Black Death. Bam! The lowest levels ever are recorded of lead in the atmosphere. Now, the thing is that all of these environmental effects of the Black Death are caused by massive death. This is the amazing moment that we're in with the coronavirus, is we are choosing to stop. We are choosing to implement a rational method of saying we have to do the social distancing, we have to get people to stop their normal lives and just stand still. And that is truly astounding. And as a historian, I will tell you, this has never happened in the world before. Of the whole world is standing still. And I think it's really, really important that we look at that happening. The other thing that I want to do, and next click, please, is I want to encourage us to start now, start immediately, and do it every day, is the task of healing. Healing ourselves and finding beauty. This is just some absolutely gorgeous tulips that somebody shared on the internet the other day, and I just snapped it up and I just said, okay, I'm gonna put this and keep it on my computer and share it with anybody who needs a hug. And the other one that I have, just a next click, please. This is a little baby donkey. And the thing is that I'm loving the humor and I'm loving the joyfulness that I'm seeing, and it is not wrong in the middle of catastrophe to find these things, because we have to have them. Just like our hands, they are part of what makes us human. So last slide, please. And then I just wanted to end this. Ed Young is a science reporter who I've been reading for quite a long time. He's got just an incredible gift of humor, love of language, and love of science. And he published last week a very long piece called How the Pandemic Will End. So actually kind of moving beyond just chronicling kind of where we are right now in terms of the peaks and curves and valleys and crises we're dealing right now, and just saying, okay, well, what will come next? And when we'll be able to say this is over. And this was one of the last things he did. Then he did a radio interview, and I just wanted to share this one passage with you. So the interviewer is asking him, okay, well, we're supposed to be working on a book, and you got interrupted, and okay, so how do we get out of this? What will be the passage out of this? And this was his answer. I look forward to a time when we can shift back into a happier mind space. I think we're living at a time right now when the natural world is science. That's what he studies. When the natural world has unexpectedly visited horror upon us. And I think it will be necessary as part of the healing process to remind ourselves that the natural world is largely full of wonder and joy and fascination and all the rest. And that's what I would like us to think about. We won't be fine. We will be changed. We will be different. We will be harmed. And we are already harmed. But we also have the capability to move forward. So with that, that's the end of my presentation, and I look forward to discussion. Thank you.
Thank you so much. That was great. And what a nice note to end on. Or I don't know if nice is the right word, but a good note to end on.
So Shane is going to put us into groups of, I think, about 3, with the idea of discussing these 3 questions. Are you already using the assignment that Bryan created and then has since been iterated on about 10 times for different contexts? If so, what successes and challenges have you experienced? How did today's talk expand your ideas about the kinds of observing and recording you might ask your students to do? And how could you use information from Dr. Green to help students understand the value of their own voices? So those are our 3 prompts. You don't have to discuss all the questions. We hope that once you arrive in the breakout rooms, you'll introduce yourself to your partners and have a conversation about what's top of mind for you. We've created a shared note-taking document that, so the shared note-taking document is in the chat, and if one person in your group could use that to capture any questions that you want us to ask of either Bryan or Dr. Green when we come back together. Bryan and I will be going through the document and taking the questions and use that as the space for moderating. And I know some people shared resources in the chat. You can also add those to the shared document as well. So one group or pair wrote, are there ideas for how to have students map their own evolution in thinking about the isolation experience with the pandemic? And so I think maybe sort of extending from your comments earlier, Monica, around noticing first and as things change, do you have any guidance about how to prompt students to think that way or structure their thinking?
I mean, I'm just thinking off the top of my head right now, but I'm just thinking, ask them to think about any part of their day that they consider routine. You know, it's, you know, making breakfast in the morning, whether it's going to the bus stop, whether it's, you know, chatting with friends in the afternoon, and just ask them to take that, whatever that one thing is, and say, is it different in any way? And it might not be, and that's okay. And then, but the thing is they can think about the ways in which, well, what I usually have for breakfast is eggs, but nobody can find any eggs at the store anymore because all the eggs are gone. So just kind of anything. I mean, even no matter how mundane it seems, again, it's that scalar thinking of the global, is just thinking about eggs moves you from your own household to the grocery store to this larger economy of where do eggs come from, who produces them, you know, is this, you know, are eggs part of the global production? Is it national? Is it international? Any one of these questions can be a way to start thinking about what has changed in my life. And I guarantee everybody will find something, in fact, very, very quickly, you know, within just kind of a couple minutes of thinking like that. They're going to see some way in which, you know, maybe they're used to, you know, getting on their phones and chatting with their friends afternoon, and now they can't because their parents are home and they're clogging up the, you know, the Wi-Fi bandwidth. So anyway, that would be my quick answer to that.
Well, and your comment has me thinking about sort of perhaps having students jot down 5 to 7 things that they do regularly, you know, in their pre-COVID life.
Yes.
Thinking about sort of a discrete list, whatever the appropriate number is per grade for a grade level. And then sort of to your point, looking at the list maybe over time, what has changed and what has stayed the same.
Yes.
And then people in the comments have made lots of then comments about then charting continuity and change. But I think starting from a place of what are the routines in one's life.
Yes. Yeah. Absolutely.
Another question is around how to merge science teaching with social studies. And so just wondering if you could talk a bit more about sort of how you work at the nexus of those two fields, and what opportunities you think there are.
Oh, the opportunities are huge. And again, it is, the science is out in front of everything that's happening right now. The science is out in front of the politics. The science is out in front of the economics. The science is out in front of kind of all the public health decisions that are being made. So one of the big things is that, and some people might have learned this by now or not, this whole flatten the curve narrative of not letting the disease spread as quickly as it would want to. So if they're now seeing, and I hope everybody has learned what an R naught is, the reproduction number for one person who has the virus, how many other people will they spread it to? And the latest one that I saw was moving it. Before they were talking about 2, maybe 2.3. Now they're talking about at least 3 people. So it's those, and this is all mathematical modeling. It is those predictions that have said, okay, this is how fast things are going to happen. If every one person who has it is going to be infecting 3 others, then this is how quickly things will escalate. And the whole idea of flattening the curve comes from historical research that was done on the 1918 flu pandemic, of watching from city to city to city, watching the spread of the disease, and they did not have testing at that point. And that's one of the huge differences, again, with where we are. And also one of the things that if we implemented the testing to the full extent available, we would have tremendous amount of control over this. But what they did in 1918 was they saw the disease was spreading in certain kinds of ways, and different cities reacted in different ways. And, they reacted at different times, and they also reacted sometimes closing the schools, sometimes not closing the schools, sometimes, prohibiting public gatherings and so forth. So that data went into these big studies that were done in the 2000s, I think. And I think the big publication came out in like 2007, and just saying, so like, for example, Philadelphia waited around to implement social distancing, whereas St. Louis implemented it early, and they were able to flatten their curve. Then they let it up too early, and then everything started rising again. So, but the point is that that's coming from science, and that is also coming from real, just genuine, old-fashioned historical work. Because, and this is the other thing people need to understand, is in 1918, they didn't know how to study viruses. They knew how, and just from empirical work, there were vaccines for a few viruses. So the most famous, the first 2 famous vaccines were the smallpox vaccine, which was developed at the end of the 18th century, and then Louis Pasteur created a vaccine for rabies. But the point is that for both of those, both with what Jenner did for smallpox and what Pasteur did for rabies, they couldn't actually detect the virus. There was no technical method. There weren't, basically it wasn't until you get electron microscopes that you can start developing ways to prove the presence of viruses. But anyway, that's just one of the ways. So, but what's happening now is now we're in the era of genetics, and this is what basically this is all the sequencing that's being done now is molecular genetics. So, finding out what an epidemiologist does, finding out what a virologist does, finding out what a historical epidemiologist like me does, and actually looking, I mean, and this has been what's been a benefit for me, I look at multiple diseases. So instead of just saying, okay, we're just going to look at this one organism and see how it behaves, what we also need to understand in looking at a pandemic situation is that the bigger factor is how do humans behave? And for that, that's where sociology comes in, that's where historians come in, that's where anthropologists come in. So all of those are tremendously important and doing a lot of behind the scenes work. And that's also what I would say is a value of Twitter is you can follow anybody you want on Twitter, and just watch what it is they're posting, watch who they're dialoguing with, and the fact of the matter is, we specialist researchers do the same thing. Is because all of us, once we step outside our little niche, we are ignoramuses too. And that's the big thing. But it's also incredibly heartening, I find, is to see so much cooperation, to see so much good-hearted communication, and to see so much cooperation.
Well, with that, I'm going to pause the discussion. And I think Shane has some closing slides, but I just feel like you summed up how we came to be here today, just in the sense of the cooperation that first started between Bryan and I making the assignment available more broadly, and then Shane reaching out to you via Twitter and you being responsive to join us here on this platform. And so, are really grateful for that interconnection that has made this possible.
Well, I'm so grateful. Thank you.
Yeah, I want to say thank you also before I move to this next thing. Don't disappear yet, Monica, and other people who are on, don't disappear quite yet,
okay.
Please. Okay, so the last thing that I want to let you guys know about is, so we are in conversation, right? We didn't feel quite ready right now because we don't have a good method yet, but we're in conversation right now about options for archiving student work. So if you give some variant of this assignment to your students, rather than I think it's great if you save it or you mail it to them later or you have them save a message for themselves, but we're also interested in a longer term archive that might be searchable, that might include work from people from other countries, for example. So we are not currently accepting work from students under the age of 13. Stay tuned, we're working on privacy and permissions around that. Students do need to give permission for their work to be shared. I know some districts already have students sign a waiver about that, but you could also institute something. We'll write something about best practices there. And then there are two paths to submit student work. Individual students can submit their own, and then teachers can submit work from whole classes. We would obviously prefer for teachers to submit so that we're not processing quite as many things. I have a closing poll, and I just would like to ask Bryan and Rachel if you want to close out while I launch the poll. I thought you maybe, especially one of the two of you, since you guys were the genesis of this.
Yeah, so there's and again, I think one of the things I appreciate most about Rachel and the project and what Arise has brought to the table and continue the collaboration piece. This started as an idea. I was sitting on the couch with my wife and I sent it to Rachel, and the next day it's off and running. So I think even in this time of quarantine that the PD you guys are doing here and teachers come together trying to get better at what we do and rethinking what we do, it's pretty cool. I like seeing you guys' comments on the side. Rachel just put a link to the original assignment, but also I think the 12 or 13 different adaptations teachers are done. So if you're going to throw something at your students, please share it with us, and we'd love to add it to the list.
Yeah, and I just want to call that out. So we posted it, and I think as soon as I posted Bryan's assignment on our Facebook page, it was just a screenshot of his original assignment. Somebody was like, well, it could do this, you could do this. And so then I was like, you can make that change. And so that was the inspiration for creating the Google Doc. And so there are elementary versions. As people have noted in the comments, there are already Spanish and French versions. And I know Shane will be excited to see that somebody is perhaps volunteering to do Arabic and Mandarin, because she was going to look into that. And so that landing page right now is the repository for all of the versions that we're collecting, as well as entry into the student work form. And pretty soon we'll get something more stable up on our website. But everything that you need with regard to the assignment is on there. And I just love all the extra thinking that Dr. Green provided us in terms of thinking about scale, and also starting with the really particular of our own daily lives, and not necessarily trying to make meaning out of it, just narrating and observing.
Mm-hmm.
Yeah, I think that's really great and helpful. I also would like to encourage any of you who have friends who are teaching in schools in other countries. I would love to get entries from other countries if they translate it into their students' language, even if the entries are not in English. I think that's a problem for future people, not necessarily us, but I am interested in collecting and worrying about the translation later. So if you know people in other countries, please share.
The next slide is just a link to the assignment. Also, we're part of the California History Social Science Project Network, and so they're collating materials, particularly for history teachers there. And hopefully you've seen the UCB Professional Development Providers calendar. We anticipate having near daily webinars for the next 5 to 6 weeks to support you all across the board in what you're trying to do in this moment. And I want to reiterate what Dr. Green said about we're all experiencing trauma and harm. And so this is our piece of sharing care with all of you. And so if there are topics that you want to learn about, do let us know, and we will be as responsive as we can to meeting those needs.
Okay. Okay, I'm going to end the meeting.
Okay.
Bye. Bye-bye.
Have everyone.
Bye. Take care, everyone.
Thanks.
Care